Hi everyone, it's Ashley from PreventConnect. Have you ever had a report or a book or just some type of document that you go back to again and again for reference or to validate the things you're thinking? You know the one I'm talking about. It's been highlighted and the pages are bent, and maybe you've shared it with a colleague, but it always ends up back on your desk because you truly value it. That was CDC's Sexual Violence Prevention Beginning the Dialogue document for me. As a new preventionist working in a rape crisis center, that document gave me the words to explain what I had always believed, that prevention is possible and that it would take more than simply raising awareness about the issue. Now, 15 years later, CDC has released Continuing the Dialogue, and PreventConnect's David Lee had an opportunity to sit down with the authors to reflect on how the field has shifted and where the field is going. I hope you enjoy.
Hello, this is David Lee from PreventConnect, and I am very excited to be joining all of you today to be talking about a brand new publication that the Centers for Disease Control and Prevention has released that's called Continuing the Dialogue. Now, I remember back in 2004 when the CDC released a document called Beginning the Dialogue that really laid out the principles of a public health approach to preventing sexual violence. And this publication highlighted important concepts of the social ecological model and defining primary prevention and applying it to the work to be able to prevent sexual violence. And since then, a lot has changed, and that document, I think, set a lot of really important foundations for what prevention looks like. But since then, we've learned a lot more. In fact, PreventConnect itself got our first funding from CDC in 2004, working to advance sexual and domestic violence prevention. So PreventConnect is sort of as old as Beginning the Dialogue, and now we have Continuing the Dialogue. So today I am joined by the three authors of this report. So I have Jenny Dills, who is a health communications specialist at the Division of Violence Prevention at the CDC. How are you doing, Jenny?
Hey, David. Thanks so much for having us.
So, Jenny, can you share why it's important that you've been working on this Continuing the Dialogue document?
Yeah, thanks, David. So I'm working in communications now in the Division of Violence Prevention. But before this, I had been working directly with grantees and recipients on their prevention work. And I had used that Beginning the Dialogue document since the early aughts when it was released, and I was working at the Missouri State Coalition. We were trying to shift people toward prevention away from just awareness raising. So that document was very formative in my prevention career development as well. And so since coming to CDC, several of us have been thinking about how do we build on that. The field has come so far since 2004. There's probably new things that we can say, new approaches that we can work into a publication. So, it's 15 years later. The field has moved in leaps and strides, and it seems like good timing to get a new technical assistance resource out. So we hope it's helpful for the field, and shout out to those authors on the Beginning the Dialogue, like Karen Lang and Neil Rainford and Margaret Brome, who really set the bar pretty high for getting prevention work going.
Well, thank you very much. We're also joined by Katie Jones, who's a program officer and subject matter expert for the Rape Prevention and Education Program at the CDC. Hi, Katie.
Hey, David.
Great. So why don't you talk about some of the reasons that you wanted to be able to work on Continuing the Dialogue?
Sure. So my everyday job is to work closely with the state health departments who administer the Rape Prevention and Education Program. And, just through my continual conversations with them, we just started to see some gaps in what we as CDC were providing to them for their technical assistance and how they could implement programs well. And so we really thought that the best avenue was building on Beginning the Dialogue and kind of creating this Continuing the Dialogue that would fill some of those gaps. And then the other thing that really kind of stood out to us was over the last few years, CDC and DVP in particular has been putting out quite a few publications and resources particularly the technical packages, Stop SV, and the Preventing Intimate Partner Violence technical package. And we also have another resource, Connecting the Dots, that we reference in continuing the dialogue. But we haven't done a really great job of, really thinking through translation and what that means for folks on the ground. And so we just thought that this document could take all of those pieces together, pull out kind of the main drive home points, and kind of bring it all together in a way that our recipients and their partners can actually use for doing their prevention work.
Well, great. Well, thank you so much, Katie. And it's great. And one of the other changes that we've seen, of course, here is that beginning the dialogue, we're talking just about sexual violence, but continuing the dialogue is looking at someone sort of in the spirit of connecting the dots, is looking at both the sexual violence prevention and intimate partner violence prevention. So that's a great direction that one of the ways that we're changing. I also am joined by the third author, Pam Brown, who is a public health analyst in the policy and partnership team at the Division of Violence Prevention of the Centers for Disease Control. And Pam, can you talk about how you see this document being really helpful?
Yeah, thanks, David. I've been working in the field of violence prevention for a long time, longer than I like to share. Started at the local level, then moved to the state level, and then came to CDC and had the opportunity to start working at the federal level. And at the federal level, worked together with Katie and Jenny directly with programs on the ground. And now that I'm in the policy arena, it's all kind of coming together, and tools like this one have been just extremely important to the field and to every aspect of the work, at least in my own experience and also what I'm seeing. What's exciting about where we are now is the evolution of the work and what we've learned since 2004 and how it can inform practitioners and others the way this earlier document helped inform us. And having the policy and partnership perspective added to that, which is so key to any public health approach to prevention, really brings it all full circle. So I'm excited that we're able to kind of bring this out to everyone.
Well, great. Well, thank you so much, Pam, and I'm glad to have all three of you joining us. I have the report right in front of me, and it's really great to see this. I had the opportunity of being one of the external reviewers in this process, so I appreciate having the opportunity to be able to think about it. So in here, as I read it, one of the shifts that I see in prevention practice is in 15 years ago, we were trying to get people to think about the social ecological model and thinking about the individual, the relationship, the community, and the societal level changes. And now we're really focusing specifically on how to make that community level and societal level changes, those higher level changes. So, Katie, can you describe a little bit about this change?
Sure, I'd be happy to. So I think one thing that's really important to say is that at CDC, we're really not trying to discourage practitioners from continuing to implement those programs that we know work at the individual and relationship level. We definitely think that it's important to continue to focus work on that so that we're making changes to individual attitudes, beliefs, and behaviors. But we also know from our research and from our experience that if we really want to make lasting changes in our communities, we have to make sure that we're looking at and addressing, the social norms, the characteristics of communities, and the conditions in our communities that are making violence more likely or less likely to occur. Those are the things that are really impacting our schools, our neighborhoods, our communities. And so we really think that if we want to create some lasting change, that we have to start by changing the environment, and the social and economic things that happen in our neighborhoods and our communities, so that we're making sure that when we are making those individual behavior, attitude, and belief changes with our kind of individual level work, that those are supported in our communities and that, those are actually able to last longer too. So those are kind of the reasons that we're looking at emphasizing the community level aspect.
Well, and that's so important, and we at PreventConnect really spend a lot of time looking at how we make community-level interventions and really doing that, because I think that's one of the lessons of public health is that we can make greater investments in changing those environments and change the conditions in which things arise to be able to make that change. And so I really appreciate having that discussion here in Continuing the Dialogue, which is the new product that has just been released by the Centers for Disease Control Prevention, talking about doing prevention of intimate partner violence and sexual violence prevention. Now, in Continuing the Dialogue, I mentioned this earlier, it's addressing both sexual violence and intimate partner violence. Jenny, can you talk about why this development is important to do?
Yeah, absolutely. I mean, just as you were saying and as Katie was saying, we really have to be smart about where we're going to have the most change, how we're going to have the most impact, how we're going to prevent the most violence in communities. And in the last 15 years, our field has expanded, but the resources, the dollars and cents in all of our prevention bank accounts, so to speak, have not necessarily caught up to the need. And so here in the Division of Violence Prevention, we're emphasizing a cross-cutting approach to prevention. We know sexual violence and intimate partner violence are interconnected, and they share, many root causes. So by addressing these shared risk and protective factors, we can be working to prevent both intimate partner violence and sexual violence using those limited resources. We can maximize our impact by addressing them together and allowing us to use our knowledge and our expertise in ways that address multiple areas of concern that communities have. Communities aren't just plagued by one or the other. They're often interconnected or co-occurring in families and in schools. And we can maximize our efforts by leveraging resources that may be obligated for one outcome but could, effectively prevent both. So we think it's really important to look across types of violence, even further to including youth violence. But for this document specifically, we were focused on connections between intimate partner and sexual violence.
Well, Jenny, this is PreventConnect, of course, does address both sexual violence and intimate partner violence prevention. And, I, in my career, have worked in both fields. And from a prevention perspective, I feel the work is very similar. And that would be reflected in the technical packages. And so many of those packages were the same. And so I think that from a prevention perspective, what we're trying to do is changing some of the social norms, empowering people, creating the changes in those conditions that are very similar. And so I think it's really great that we look about how we can do this hand in hand and how we move forward. And I like how you're making the linkages to other issues. And this kind of gets to my next question is, the other piece that we're Continuing the Dialogue makes really explicit is about efforts need to reduce the impact of oppression and through addressing the social determinants of health. And so we're not just looking at the issue of sexual violence or intimate partner violence in a vacuum. We're really looking at that in the context of how this takes place within oppression and social determinants of health. So, Katie, why don't you talk a little bit about how the prevention of sexual and intimate partner violence is connected to the social determinants of health?
Sure. And I will say, I think after we worked on this document together, I think one thing that I recognized is I think this could be, thinking about social determinants of health and intersectionality could probably be its own publication. And so, we really, I think, just scratched the surface on this topic. But I think it's important for us to identify what we mean when we say social determinants of health. And so we're talking about the conditions in the places where people live, where they work, where they play, and how that impacts their health and also their risks for, multiple health outcomes. And of course, one of those risks that they see and that we see in people's lives is violence. And we believe here at CDC, and I think, most people believe this, that everyone should have access to safe and affordable housing. They should, be able to get access to safe and affordable quality childcare, and children should have access to, good education. Our workplaces should be safe and healthy for us when we show up every day. And our communities in general should be free from violence. I think everyone believes these things. But all too often what we find is that these opportunities really aren't available for everybody in every community. So there's kind of this disproportionate access that we see. And so we wanted to make sure that people understood through this publication is that, when we focus on changing the safety, the equity, and the accessibility of our schools, our neighborhoods, and our workplaces, we can start to think through how we can start addressing social determinants of health so that everyone in your community is given access to having an opportunity to live a safer and healthier life. And what we do know, and one thing that we really try to stress in the document, is that sexual and intimate partner violence strategies can do this. They can help ensure that everyone in the community has access to these safe schools, these safe neighborhoods, and these safe workplaces.
I think that I really appreciate this, and I know with PreventConnect, a growing theme has been looking at some of and this ties back to that community level changes that we're talking about, because those really affect so those are social determinants, are not just about individual experiences, but looking at the systems and how we can be able to affect those to make that change.
Oh, I think we've just learned a lot in the last 15 years. It's hard to pick out what's the most important learning, and we're learning continually. We're continuing to learn. I think that one big one is that as we as practitioners have been honing our craft and adding to our toolbox of what we can do, we've recognized the need to also bring communities, partners, and the general public along with us to support that work. So learning how to refine and build on our communication in ways that really stress the preventability of sexual violence and intimate partner violence, the fact that we can prevent it from occurring in the first place, but also doing that using language that is easily understood, straightforward, and easily repeated by our public to keep resonating with various audiences, not only what we've learned, but how they can help to spread that word in ways that there's more uptake of primary prevention work. We definitely have seen that practitioners have recognized the value of their data, how to use what they're learning, not only just the outcomes of what they're learning, but how they're learning it, and what it's teaching them in ways that really is powerful to improve their programs and also talk about their work. So that ability to really capture what's changing and what's happening and to communicate that, I think, is growing, and it's exciting to see. And there's a lot more work to do. We do know and we recognize that it's not only about CDC putting out information and conducting research, but also learning from the practitioners in the field who really bring that research alive and understanding the value of that feedback loop and that circular process of, just because we build it doesn't mean people will come. We need to understand what happens once it's built and how we can keep improving on the building that we're doing. And so the value of the practice and research to practice feedback loop is just so important. And another piece of that communication that we're refining constantly. In terms of partnerships, we need to make sexual violence and intimate partner violence prevention part of the national dialogue for the general public, which includes a lot of different sectors. This work doesn't only belong to public health or our coalitions at the state and local levels. It's work that belongs to everyone, and everyone is part of the solution. So cultivating those new partnerships, really adding voices that have maybe not been heard before is something else we're seeing, and actually leadership from voices that have not been heard from before around these issues, and helping to educate them as well about the preventability of the work is something else that has become a big priority and is embedded in our work now much more than it was early on.
What you described, Pam, is sort of really, I think, encapsulates what that shift is from beginning a dialogue to actually now continuing a dialogue. And the dialogue is not just new topics, but it's also new people having those conversations. And that dialogue is also about the dialogue about what we learn from doing work in communities and what we learn from research and how they influence each other to be able to make a change. So, Jenny, when you look at this, what are the next part of this dialogue that we need to be able to take on so we can improve what our prevention efforts are, so we can actually work towards decreasing and hopefully eventually towards, greatly reducing intimate partner violence and sexual violence?
Yeah, I wish I had a solid answer on this is what we need to do next to really just wrap this up and end all the violence. But, we've got more work to do across policy, across partnerships, across communication. I think our technical packages, which are these documents that outline sort of the best available research evidence in prevention for intimate partner and sexual violence, they outline a great arguments for how important partnerships are. So as Pam was talking about, where there are areas where public health can take the lead, but where other sectors are better suited. So, where can we really rely on education, criminal justice, businesses, and faith communities as sort of taking sector leadership for prevention. So there's more areas to move toward with communication, really honing our prevention messages so that they resonate with more audiences, so that we can gain more support for the work and get more resources, which then contribute to expanding our work and expanding this dialogue to new partners and new areas and new sectors. And I think there's more support now, more now than ever, for focusing on those root causes of violence and having really hard discussions around race and class and gender and how those things contribute to violence occurring in our communities. And so taking a more intersectional approach, and as Katie described, thinking more strategically around social determinants of health. All that to say that in another 15 years, I hope that we don't need a new version of this document. We will have prevented all the violence. So there will not be a third installment called, Ending the Dialogue or Finishing the Dialogue. I really hope that where the field is and what communities are doing on the ground is just really propelling us forward so that, we won't be recording another podcast 15 years from now on, trudging along with the dialogue. We will have more solutions by then.
Well, I just looking at what we've learned in the last 15 years and seeing the shift, I go a lot. I, like Pam, go way back longer in doing this work for many decades and seeing some of the shifts, and we've made some profound changes, and there's a lot of profound changes that still need to happen, but I think we're more ready for it and have those tools and continue the dialogue. This new piece from the Centers for Disease Control and Prevention, the subtitle is Learning from the Past and Looking to the Future of Intimate Partner Violence and Sexual Violence Prevention, I think marks that and helps continue that discussion. And PreventConnect is a place where we have the dialogue on our web conferences, so I encourage people to listen to our other podcasts, join us on our web conferences as we engage in that dialogue and learn and make impacts in our community. I want to really thank Jenny Dills, Katie Jones, and Pam Brown from the Centers for Disease Control for joining me today, and encourage everyone to go to the CDC on the PreventConnect page and also on the CDC's Division of Violence Prevention section on their website. You can be able to download Continuing the Dialogue, so I encourage you to read it. So thank you all, and hope you have a good rest of your day, and I'll see you as we continue having our dialogue together.
Thanks, David.
Thanks, David.
Thanks.